If you have some neck pain and you have a massage gun, this video is for you. Let's help you out. Go ahead and rev that up. And let's get it on your trap right now. So you do the mirror image of what I'm doing. Take this in your left hand, put it on your right trap, and let's just get the vibration going, and let's do some rotations. So just go ahead and turn your head to one side. You'll feel that rotate, and go as far as you can without hurting yourself. Just greet the pain. Don't go into it. Don't bust the door down, and pull your shoulders down towards your butt so that your traps aren't up by your ears. And let's just do a little rotation. We're gonna start out with some active movement, and then we'll do some static stretches and hopefully get you feeling better. I also have some strengthening and exercise neck videos that you might wanna check out. Okay, let's go ahead and move to the other side and put that in the other hand right on that trapezius, and let's rotate. Good. It's amazing. Rotation and movement is just incredible for decreasing and pumping out inflammation. It's really, a lot of times people, oh, I'm gonna ice my knee. You know what? Take a walk. I'm gonna ice my low back. Take a walk. Get that movement flowing, and oftentimes you can get things to just flush right out. Get those facet joints to start pumping, get those muscles to start really stretching out and moving fluid through. Okay, so we're gonna go now, other side again. This time it's the scalene muscle. You're gonna go to the base of that scalene, right in this pocket right here, where your clavicle and your scapula make this little triangle, and we're just gonna go to the side. You're gonna come here and back up, here and back up. Again, if you're only going here, that's okay. You're all right, whatever you're able to do today. It's sort of, there's something called controlled articular rotations. There's controlled movements where you just go to the pain and you greet it. And you go to the pain and you greet it. So now we're gonna go to the side, and then we're just gonna nod yes and no as we're in lateral flexion. Feel dizzy or weird, this vibration is a little too much for you. You might be dehydrated, or you might not be ready for this. Go to my other neck videos. All right, let's go to the other side, and just right on that scalene, and we're gonna do some lateral flexion away from it. The vibration really helps those muscles release. It helps them go further. Go ahead and just let it go all the way to the side. Think happy thoughts. When you think unhappy thoughts, you get something called uptight, which generally means tight up here. So we want that to be untight, to be unwound. Okay, now let's just stay there for a second, and we're just gonna go nod our head like this. Feel the vibration in the face, and let that smile envelop your whole being right now. Good. Oh, it's so good. So now we'll go into some static stretches. Keep it in the same hand, and let's go 45 degrees right here. And then we're gonna put the massage gun right on the trap. You can move it way up into the suboccipital area. You just have to be careful that you don't get dizzy. But I do like it. I like to start here and then just move it down into the trap. Move it down into the trap. Feels like it's gonna rattle your brain a little bit. Relax that face. There's something called trigger points, and sometimes you get trigger points, and those really react to emotion. So you wanna keep your body and while you're working on your muscles, you wanna keep your face relaxed. You don't wanna grimace. So now let's go to the scalene again. We're gonna pull that ear to the shoulder and just place it right at the bottom of that scalene. We're not going to need to move it too much. If you have a massage gun, you might be out here. This is more of a mini gun. And just feel that face relaxing. You can move up if your neck allows. And if you can't hold, just go like that. There we go. Okay, let's go to the opposite trap. So we're gonna pull it 45 degrees, just like this, and just get that massage gun on there. You know, your discs don't have a good blood supply after the age of 12. They get their nutrition from movement. actually. So even when you're moving like this, the disc is opening up in the posterior part of it, and then you vibrate it, it tends to create a little more imbibition, a little drinking in of the disc. So go ahead and move up into the suboccipital region if you can. Sometimes you just want to kiss it. You just want to just barely get a little bit of vibration in that muscle. Just enough for it to go, okay, I'll relax. I'll let go already. And a lot of times people do a lot of massage, theracane, stretching of their neck. But really another thing to do is strengthen the infrascapular muscles, pulling the scapula down. A lot of my shoulder videos do that so that now your shoulders have a place to go. It isn't just don't go here, it's come on over here. Pull the shoulders down. So now get that ear to the shoulder and just vibrate, just like this. You're gonna feel a little better after this. It's gonna be nice. So good. So we're gonna get a muscle called the Platysma. We're gonna bring your chin down and pull the skin down away from your neck and then just lift here. This one, you don't wanna put the massage gun on the front of your neck. It's not good. You have the carotid arteries in there. So just bring it down below the neck and just lift and push that chin up towards the ceiling. And just turn left and right. Again, if you feel dizzy or weird, just stop. Just a little turning, barely. Close those, put those teeth together. Okay, now some muscles that aren't associated really with the neck. Oh, now just feel that. You just gave to yourself in a good way. Is the pectoralis minor. So I'm gonna have you go goal post here and bring that shoulder back and then go right underneath the clavicle to the pec minor and let's get that pec minor. When it gets tight from using a trackpad or getting on your phone or whatnot, the shoulders come forward, it changes your breath, it changes your posture. It's really not a good thing. So we want to kind of stretch the front of the body, strengthen the back of the body, what's called the posterior chain. And just feel that. And now we're going to go along the rib heads. You're just going to go a little bit. Actually, this is where the cartilage meets the sternum. And we're just going to do a few vibrations there, help you breathe a little bit better. Take a big breath into that. Good, and just work that front area, not right in the front, but just over to the side. Good, so let's go to the other side, goal post the arm, bring it back, open that shoulder, counteracting a little of our modern daily lives. Isn't it nice to give yourself a little self-care so that when you re-enter back into your day, you're just a little more relaxed, a little happier. And let's go ahead to the front right here. And take some deep breaths in through your nose, out through your nose if you can. And then coming up to the next rib. Good. Just the feeling of that vibration. Stimulating some proprioception. Beautiful. Now that's putting some modern technology to work. Way to take care of yourself. Have a beautiful day and look at my other neck videos.